we're going to review some of the myths or popular misconceptions about plastic surgery on the eyes. So I'm going to share with you 6 myths related to blepharoplasty. So the first misconception is that blepharoplasty is only for older people, and that's just not true. In the past, only older people had this type of surgery. It was done for functional reason. When your upper eyelid starts weighing down on your lashes and you can't see, then yes, you would get that surgery to help with your vision. Nowadays, people are pursuing it cosmetically because they want that nice torso show to put your eyeshadow, or they just want that younger look where it doesn't look like they're tired all the time. So more people are going through this type of surgery at a younger age. So the myth is not correct. One of the myths about blepharoplasty is that the results are immediate, and I'm going to break it up into 2 surgeries, the upper and the lowers. So the upper surgery, honestly, you do see the results right away. However, you still have stitches and all that, and it takes a little time for things to settle down. It's not exactly immediate. The second surgery, or what we call lower eyelid surgery, the swelling goes for a little bit longer, and so you don't get results right away. You have to wait for all the swelling to calm down, which in the area of the under eye, the lymphatic drainage is a little bit slower, and so it takes longer. The third myth about eyelid surgery is that it results in a significant change in your appearance. And well done upper and lower eyelid surgery should not result in a significant or perceptible change in your appearance. In other words, you should just look less tired. No one should say, oh my gosh, I saw, you look like you had eyelid surgery done. So if things are done naturally, it just makes you look like you've rested and had many nights of good sleep. One of the things with lower eyelid surgery is if it's done too aggressively or incorrectly, your lower lids can get pulled down, and that results in some perceptible changes in your appearance. So well done surgery should not result in experience that your face changes because of it. One of the myths about eyelid surgery is that it's very painful, and that's just not true. I counsel patients on the recovery process, and if we get that down to a T, you should not notice anything other than swelling as a sensation. So for the first day for eyelid surgery, I usually tell patients that the upper eyelids, you feel the sensation of a paper cut. If you manage that by putting a lot of ointment on it, that paper cut sensation goes away, and then you manage the swelling with icing that area. That reduces their bruising. The next day, they just have some minor bruising. Everything is more in the acute phase of recovery, which is initial 6 hours. And if you manage that well, your future days should be much easier. And honestly, it's not painful at all. So one of the myths about eyelid surgery is that the recovery time is too long. For the upper eyelids, your recovery time is literally 1 week, 6 days. You do have some bruising that in older individuals may last for 2 weeks, but I usually tell patients it really looks like purple eyeshadow. On the lower eyelids though, it is slightly longer, but the bruising is the same amount of time. It's not prolonged. It's only about like 10 days of bruising per se. But the swelling in some individuals can last longer. So it can last about 6 weeks. Should not be longer than that. So one of the misconceptions about eyelid surgery is that it always results in eyelid scars. For upper eyelid surgery, definitely no. It's hidden in the crease of your eyes. When they open and close, there's that crease. It's hidden there, very imperceptible when it heals. Most people forget that they even had it done, and no one can find that scar just because of how that skin there heals. In the lower eyelid, there may be some truth to that myth, and the reason for it is if the lower eyelid scar is not placed well, it can sometimes pull down and you can see it more if you're looking for it. If you're keen and taught how to look for it, you can recognize it. But again, if you're not taught how to recognize those incisional sites, most people can't tell where the scars are, but they just can tell that you had lower eyelid surgery. So that one's, there's some truth to it.